Your presence is important to us, Your Excellency, because it's good to share what is a proud moment for Kenya. And while some may take it for granted that the inoculation against COVID-19 is a state task and responsibility, it is also key to note and appreciate that Kenya is among the first countries on the continent to receive and commence COVID-19 vaccination program. And we are now in the league of those who have properly and strategically prepared and planned its rollout. I can assure you that nothing has been left to chance, and today we celebrate the deployment of these life-saving COVID-19 vaccines to 47 counties through regional vaccine depots. We are effectively altering the health risks that face our people and that has devastated us. As I said, Your Excellency, the other day we were at JKIA when we received this consignment, and we said that this consignment essentially is an ammunition that we need to fight this coronavirus war. They are tantamount to the bazookas, guns, and tanks required for war. With them, we are now indeed fully fledged to fight COVID-19 like an insurgency. Your Excellency, the vaccines are one of the many investments we have undertaken in transforming healthcare, which is a key driver of universal health coverage, when coupled with the countless and other investments and reforms that we can be sure to reap worthwhile dividends. Over the last decade, Your Excellency, the government has scaled up coverage of immunization services from 50% to more than 90% of health facilities through procurement and installation of specialized vaccine storage equipment in over 5,000 health facilities, setting up of 290 county vaccine depots, and construction of a national and 8 regional ultra-modern vaccine depots, among others. And Your Excellency, this particular facility that we are now in was built in 2013 with the support of the Japanese International Cooperation Agency, JICA, in order to expand storage and handling capacity for vaccines in the Ministry of Health. And we are very grateful for this partnership. It has the capacity to store more than 6 months of vaccine stock for the country at any one time, and it boasts of more than enough vaccine cold and freezer rooms. Specifically, it can store 130,000 liters under 2 to 8 degrees temperatures and a negative capacity of 14,000 liters in the -20 Celsius, which means, Your Excellency, that we are able in this region, in this lab here, to even store the Moderna vaccines once we get them, and we are able to deal with just about every other vaccine, with perhaps the exception of Pfizer, that needs over 70 degrees. So this infrastructure, sir, is going to be key in deployment of COVID-19 vaccines. And for those of you who are wondering what will happen if this area suffers a power outage, I am happy to report that the facility has a standby generator and is able to run all the equipment at any time, all times, leaving nothing to chance. Your Excellency, I think I would also like to take this opportunity to mention that every year, this facility handles vaccines worth more than 6 billion shillings. These include childhood vaccines, such as tuberculosis vaccine, the polio vaccine, the pentavalent vaccine, rotavirus vaccine, measles, etc., etc. And from the ports of entry and the depots, vaccines are distributed quarterly to more than 8,000 health facilities in the counties through 9 regional depots. So, Your Excellency, I would like to assure you and assure Kenyans that we have capacity as a nation to handle the challenges that may come with the transportation, with the storage, and with the entire chain that is required to ensure that our people are safely vaccinated. So I therefore wish to assure you, sir, that the ministry We will continue to invest in this expansion of the cold chain, and as noted, we have adequate capacity to manage all this. And I would also like to add, sir, that an appeal to our colleagues in the fourth estate, that even as we do this, as we carry out this activity, let us be sensitive to the information that might be passed around. For example, when we are talking about the costs of vaccine, sir, what we have got here has not been bought, not a single shilling has been used, as opposed to popular debates around how much, whether we are buying more than Brazil and other things. The truth of the matter is that the current vaccines delivered here by UNICEF we have not spent any money whatsoever.
And I cannot but once again re-emphasize that despite the fact that the vaccine has arrived and will continue, because we will get more and more doses until we meet our requirement, that does not remove from every single citizen the obligation and the duty to continue to maintain the health protocols that we have been given by our doctors, by our experts. We must continue with face mask wearing. We must continue with hand washing and sanitizing. We must continue with social distancing, because ultimately these are the factors that shall ensure that we are able to combat and defeat this deadly virus that has infected the globe and that has resulted in a huge social as well as economic crisis that is global. So let us continue to work together and partner together, while I once again say thank you very much to all those who have been concerned with this particular process, and once again also to thank all Kenyans, wherever they may be, for the manner in which we have worked together hand in hand to be able to ensure that the level of death and the level of loss of life and illness has been maintained. We have had it, yes, but it could have been much worse had it not been for the manner in which our population, our health experts, and everybody have worked hand in hand in order for us to ensure that we have minimized the impact of this virus as we steadily and slowly move towards the reopening of our society, our economy, and to get back to as normal as we possibly can, building back better for a better, brighter future for all of us. So, ladies and gentlemen, let me just say it's a great pleasure and a great day of joy as we are here to see the launch of the distribution of this vaccine across our country to all the various regional centers, vaccine centers, and ultimately to the various health centers across the country, in order to be able to facilitate our people to be injected with this vaccine as part of our process of combating and helping us defeat this deadly disease that has faced us, not just here in Kenya, but globally. To take this opportunity to also thank all our partners who have joined hands with us to help us execute this particular program, and to assure Kenyans that this program will be rolled out countrywide. And indeed, our policy, and it has been clearly stated, and I would really appeal to our colleagues in the Fourth Estate to stop disseminating rumors and half-truths. We have met as a cabinet, and we have made it very clear that the policy of my administration is that the first persons to be administered with this vaccine shall be our frontline health workers. That is category number 1. Those will be immediately followed by our category number 2, which will be our police forces, our security forces, who also, due to the nature of their work, are also equally frontline workers. All emergency service providers will be in that category. Inclusive of them will be our teachers, because as you know, we have resumed learning, and our teachers are equally just as exposed, as we also move to those who have comorbidities and those above the age of 58, as we move to the rest of the population. So I would really plead with you to stop any kind of insinuation that may create dissatisfaction amongst your people. This is a time for us to come together and ensure that we are able to provide this much needed service, this much needed vaccine to our people. And we will walk that journey with you. As far as we are concerned in government, ours is to help these wonderful people who work day and night to ensure that we support them with logistics, that we support them to ensure that they are able to get the vaccine out, that we support them to ensure that we have enough doses to cover our population so that the exercise is continuous until such time as we have completely vaccinated our people, or at least have been able to achieve what we are being told is referred to as herd immunity. But it will be their responsibility. They are the experts. They are the ones who will guide us. And if you have any questions outside of policy, which I have just detailed out to you, of how this vaccine will be rolled out, that is policy. With regard to the execution and how it will be done, ask the professionals, ask the technicians, because it is in their hands. They are the ones who will be in a position to guide and to tell you how many doses have been distributed to what part of the country, how many people have been vaccinated, how many health workers have been vaccinated, how many policemen and security men have been vaccinated, firemen, all these frontline workers, how many teachers, and so on and so forth, so that we are able to report factually. We have nothing to hide. We want to report factually. But that is not made easier when people depend on rumors. The professionals are here. Wapi daktari? Huyu ndio mwenye kiwanja. Mkiwa na maswali, ofisi yake ni hapa, jameni, njooni mumuulize. Wapi Amos? Huyu mwingine. Mkiwa na swali, muulize. Sisi mtuulize policy. Na policy I have just detailed out to you the policy that we are planned to utilize. The work will be done by these people, and ask them. They are available to you to answer whatever questions that you may have. Sini namna hiyo wenzangu. Na ndio tuweze tusaidiane pamoja na tuhakikishe ya kwamba tumesaidia taifa letu na tumesaidia wananchi wetu. Vaccine nationalism is something that we should all abhor. We are very clear, and I think if you ask any expert, there is no single country that will be able to be safe unless all of us are safe. So we all have an obligation to ensure that this vaccine is made available as widely, as cheaply, and as quickly as possible to all citizens of the globe. Secondly, I also want to take this opportunity because last year, as the process of vaccine development was going on, we ourselves as an African Union, and in particular, the Bureau of the African Union, of which I was a member, chaired by the South African President, Cyril Ramaphosa, we took a decision that we are also not going to sit back and wait until such time that a vaccine has been discovered. We will also begin a proactive process of ensuring that this vaccine is also going to be able to be available to people across the continent. And in fact, I am happy to say, as a result of that initiative, we are standing here today barely a few weeks after the most developed countries and beginning our own process of vaccination, whereas previously we would probably have had to wait for years and years while the rest of the world was moving ahead, but this time round, because of the proactive nature that we adopted, because of working together as an African continent, we are barely weeks behind the rest of the world. And I think this is the spirit that we in Africa must continue to adopt until we overcome this disease, but even as we face other challenges as we move forward. And I also once again would like to say I'm thanking all those partners who have supported not only Kenya, but the African continent in this particular process. Tuko na furaha sana kuwa pamoja nanyi siku ya leo, tukiwa tumekuja kujionea mwanzo ya safari yetu ya kupambana na huu ugonjwa wa Covid-19 ambao umekumba taifa letu la Kenya na dunia mzima. Nataka kushukuru wale wote ambao wamehusika, wafadhili na wengine wote ambao tumesaidiana nao ndio tuweze tufike pahali ambapo tumefika siku ya leo. Hii ni mwanzo. Nataka sisi zote tujue hivyo. Huu ni mwanzo, sio mwisho wa safari. Na tunataka kuhakikisha ya kwamba Wakenya wote wameweza kupata chanjo ambaye itawasaidia kuzuia huu ugonjwa wa Covid-19. Na hata wakati tunaanza hiyo safari, ningeendelea kuhimizia wenzangu wa Kenya ya kwamba bado jangwa hili la ugonjwa liko nasi. Tusione ya kwamba sasa madawa yamefika, maisha itarudi kikawaida. Naendelea kuwaomba kwa heshima kubwa sana Wakenya wenzangu ya kwamba lazima tuendelee kujikinga na huu ugonjwa. Lazima tuendelee kuvaa barakoa. Lazima tuendelee kusafisha mikono na kutumia sanitizer. Lazima tuendelee na mpangilio wetu wa social distancing, kwa sababu ugonjwa haujaondoka, bado uko nasi. Na yetu na kile kitu cha muhimu sana ni kuhakikisha ya kwamba tumezuia vifo ambavyo tungeepuka kama tungefuatilia masharti ambao tuwaendelea kupatiwa na wenzetu ambao ndio wataalamu wa kiafya na wako hapa. Najua tumechoka kwa sababu tumesema hii ugonjwa imetuharibia mambo mengi, na ni kweli. Lakini naendelea kuhimiza kwa wenzangu ya kwamba mambo haya mengine yote tuwaweza kurudisha, lakini maisha tukiyapoteza hatuna nguvu za kuyarudisha. Na ndipo jukumu letu sisi wote ni kuhakikisha ya kwamba tuendelee kusaidiana na kujipanga kuzuia huu ugonjwa usiendelee kuenea na kupoteza maisha ya wananchi wetu.